Hello and welcome to another episode of the Prepping with Darren podcast. My name is Darren, your host. Now this is going to be episode 12, and today I was wanting to give you guys an update as to what is going on with the COVID-19, the coronavirus. Now currently there's at least one case here in the county that I live in, but there's more cases that they are pretty sure will be positive. They just don't have tests to test them anymore. But they'll hopefully get more tests soon. And we should actually be getting an update from the state in about 30-40 minutes. But currently, the case count for here in the States is going to be right about 27,021. Now, the current death, that is at 344. And so far, we have had 29 people that have recovered. Now, in my state, state of Ohio, as of yesterday, we had 247 cases with three deaths. Now, I'm pretty positive that number is going to go up today because we had more in other counties that did test out late last night that they got the results back, and those did test out positive. As far as like let me bring up the nationwide or the worldwide stats right now. Currently there are, and this is at right about 1:28 Eastern time on March 22nd. Currently we have 332,164 cases worldwide, and with a worldwide death toll of 14,321. Now, currently, there are still 221,215 unresolved cases, but there has been just at 96,628 people that have recovered from the coronavirus, COVID-19. Now, I do know that China was saying that they weren't getting any more new cases, but that's not the case anymore. They are starting to admit more cases and deaths. Currently, China is the leader in the numbers. Now, China has 81,054 cases currently, but that's official. But they're pretty sure there's a lot more than that. There has been a total of 3,261 deaths in China. Now, Italy is the next runner-up. They currently have 59,138 cases, with right at it looks like 5,560 deaths, or no, 5,476 deaths. Now they've been getting quite a bit more death toll numbers going up every day, as well as cases. Now here in the States, it actually looks like it might have just been recently updated. Currently, there are 29,929 cases, with new cases of 3,900, and death toll is 344. So we are number 3 as far as the worldwide stats go for the amount of cases. Now, the next closest one would be Spain, and they are currently at 28,603 cases with 1,756 deaths. Now, Italy has the highest amount of death toll right now, mainly because their healthcare system got overloaded so soon. Now that can happen pretty much anywhere, and that is what they're trying to not let happen here in the States. Now, there are a lot of people that don't like the fact that a lot of places are currently going in lockdowns, stay-at-home orders, things like that. Now that is mainly to slow down the amount of people that get sick at one point in time, because they know that our healthcare system just cannot, well, frankly, just can't support it all, support everybody that's sick at once. There's people that say, why don't we just go out and we all get sick at the same time? Like back in the day, they had pox parties. That was that happened quite a bit back in the day, but this is something that they don't want everyone to catch at the same time because it just overload the system, the healthcare system. There's people with underlying health conditions like asthma, people that just or people that have recovered from cancer recently or are currently going through chemo treatments. That will really affect your immune system, and it's folks like that that have a harder chance of fighting off this virus. Now, the World Health Organization did say that, well, there were some conflicting stories going on about the taking ibuprofen, but currently they are stating that there is no correlation with ibuprofen actually making cases worse, but they're still looking into finding out more about that exactly. It very well could, but currently things are looking like it's not actually making it worse like it was originally thought. So that is a plus. Um, but anytime you're sick with anything, you really should consult a doctor before taking any kind of NSAIDs or anything like that. Currently, it looks like every state here in the U.S. does have a confirmed case, but not all states have death. Not all states do have deaths in them. Now, one thing I did want to talk about was as far as the states here in the U.S. The highest number of cases currently is going to be New York, and they are right at 15. Looks like 15. Well, it looks like the number bumped up again. Just recently updated. The current New York cases is right at 15,168 cases with 80 deaths. Now they showed that there's 60 in serious, but that's showed that for a while. So I'm not sure if that's actually getting updated. But currently here in the States, we've had 29 recovered. Now, Washington State, they're the next runner up. They have 1,793 cases with 96 deaths. Ohio still hasn't updated any of theirs, but it looks like they will be having a press conference here in about 30 minutes or so. Now, New Jersey was another place that ended up getting quite a few cases, as well as California. I know SoCal, they were doing like stay at home orders and things like that. There's been multiple states that's doing that now. Bars have closed down, restaurants have closed down as far as like the lobby itself. Now there are a lot that do still offer drive-through, so that is a positive. And you can also still do like the Uber Eats things like that, where they deliver the food to you. I think there's like DoorDash, some other things as well that you can do for like food to be brought to you. Now there are places that are, well, there are actually a lot of people out of work right now because of the places closing down. Currently, I'm working, and looks like we won't have an issue. We're gonna keep rolling. Now that might change in the future. I don't think so, because since we are essential workers, we gotta keep everything moving, keep everything stocked up. Freight should be moving all the time anyways to keep everything stocked up because everything right now is being the store shelves are being emptied out because of people panic buying. That's one of the main things that's going on right now with truckers. We are finding a lot less places to be able to stop off at and eat. Rest areas in Pennsylvania. Now I think they are talking about opening some of those back up for just rest areas for truckers. Hopefully that is the case because I go over there a little bit more often now than what I was when I first started on this account. But we go over to Pennsylvania, and there's not much to stop. Well, where we're going, there's not much to stop at to stop off and take a piss. So you just kind of screwed. You gotta hold it until you get there or get to another truck stop. But hopefully they will be opening those back up here shortly. Now there's other states like Florida. They have a lot of cases. Florida was actually in the news here recently from the spring breakers. I guess there was some people from over in France that came over as well at some point in time uh, for spring break, and they weren't practicing the social distancing and stuff. People weren't too happy about that. Now there's also been cases where I guess even in Seattle there's a lot of people at get-togethers, parks, and things like that, and then they shouldn't be. Now the reason that they want to do the social distancing is because they want to slow down the spread, but slowing down the amount of people that get it at one point in time will more likely save lives. I mean, look at how Italy's doing right now. It's not doing too good over there. They're losing quite a few people, mostly in part due to not being able to have enough rooms and beds for everybody or ventilators. And I was pretty sure that would be up by 30,000 before Monday or after Monday. I figured we would, but apparently we are already at 30,000 or above 30,000. I do expect that we'll be getting close to as many cases as Italy. And there's another thing about the amount of cases that we have. We There's a lot of states that don't have enough tests to test everybody, so that does play a factor in that. That does play a factor in that as well. When you're factoring up the death rate, the percentage of the deaths and stuff, and not having accurate information like the amount of people that actually have it and the amount of people that have died, that skews the data, and that can make it go higher or lower. But they're pretty sure that there's a lot more people that have the coronavirus or COVID-19 than than they currently are aware of because the issue with testing. Now the testing issues have gotten a little bit better than what it was when it was just a CDC testing, but they are still behind and don't really have enough tests for everybody. So that doesn't really do too much good to be able to contain things whenever you don't know how many people actually have it, because you can have it and not show any symptoms, but still be spreading it around. Now, Ohio has recently done a thing where they're wanting employers to start screening everybody before they come into work or other businesses to be able to check you for temperatures. Now, some are doing it, some are not. From what I've understood, a lot of hospitals are doing that, and some other businesses are doing it as well. But there's also issues with getting enough thermometers and stuff, temperature gauges. There's issue with getting the amount that they need for that as well. But hopefully there won't be any more deaths here in Ohio anytime soon. But that's not likely going to be the case. As of yesterday, we did have the 200. We'll say it's 247, 274 cases, and that number is just going to keep going up. They do expect that we are going to have close to 100,000 here I guess here in Ohio alone is what they're expecting. But that is a pretty high number. But I guess there's like 11 million some odd people that live here in the state of Ohio. So that very well could be the case before it is all said and done and over with. Now there's been different time projections of when it'll peak. Um, some are saying it'll be June. Some are saying it won't be until August. And there's also concerns that this is going to be coming back just like the flu every year. The flu comes back every year, different strains. They're also worried that this is going to be the same case as well. Now, they are currently working on a vaccine, but the vaccine will not be ready at least for another year, at least. but they are starting trials on it already, which I wouldn't want to be the first ones to do that. Vaccines, when they're new medical stuff like that, and they're testing things, clinical studies, they, I guess they, in some instances, they do pay you, but I guess that's to compensate you if you get messed up. So that's something I would not want to do, be the first ones for it. So hopefully, with the social distancing, things like that, things will start getting a little bit better. But then again, it might not, because there's a lot of people not doing it. There's still people going out doing things. Still people having to go to work, and that's another thing as well. There are talks about issuing checks to citizens uh, to help, I guess, keep the economy going. Now the stock market, that's a whole other ball game right there. It's up and down. It's not looking too good. Now with our with the way our economy runs, if the stocks crash, well, that's there goes the dollar really. I mean, if you look at how the Great Depression, I think it was back in the 20s or 30s, can't remember offhand, but that was due to the stocks crashing. Now we had a back in 2008, 2009 time frame with the housing bust. That was a mini recession. Now there's also talks about there's going to be another recession. Uh, I mean, if you think about the amount of people that are actually out of work and that don't have money put back to pay bills and stuff like that, it's not going to be good. And that's one nice thing about being a driver. You know, we're not likely to get shut down and put out of work unless we get sick. Now that is one thing that I have noticed over the last about the last month or so. That it started out with just one place that I went to, started questioning people coming in before they were able to go in to the facility if they've been in contact with anybody that's been sick or if we've been sick ourselves. And from what I understood is that if you said yes to any of that, you wouldn't get it. You wouldn't get access to the property. Now that was only one that was doing it about a month or so ago. Now a few other places I've been to have started doing it, and now a lot of the places we go to, they no longer allow drivers to go in and use restrooms or anything like that. Pretty much we can just drop and hook. So we'll have to either use the restroom before we get there or after. So that does kind of make it a pain because there's a lot of places we go to that there's no restrooms for a couple hours. But currently there are no further updates as far as the issues with the ibuprofen making it worse or anything. Now there was a pill. Um, I want to say it was a malaria drug that they were using. Yeah, I guess there's a couple different malaria drugs that they're, or a couple different drugs that they are using. But with those drugs, there are quite a few side effects. There's one that looks like chloroquine. I'll go with the names on pills, but there are, I guess there are a few different ones that they are talking about using. But they do have their drawbacks as well. So you definitely want to make sure you look into that before you just start taking everything. Now you that would be prescribed to you, so your doctor should discuss all that with you. But if they don't, ask them about the side effects. If you get to the point to where you actually need something like that, like I said before, you should be trying to boost your immune system naturally with you can either use supplements. Now I'm no doctor, so I can't tell you what you should be taking. But what I do is I take vitamin D3, vitamin B12. Now vitamin C, I get I try and drink a glass of lemon water every day before work. Now, that doesn't always pan out, but I try to. Now vitamin D3, uh, with with the summer coming up, springtime it's warming up. You can get outside. Well, you would normally be able to get outside and soak up some sun, but with the social distancing and stuff, you really shouldn't be going out doing too much. But with me, since I do get out now, I've actually tomorrow I'll be starting on the day shift, switching from night, so that'll be a big change for me. So I'll be able to get more sunlight, natural vitamin D. There are other things like vitamin K, um, other vitamins that well, vitamins and minerals that I do ingest through a diet as well. They do help boost your immune system. Now, me, I have been told that I have asthma, and that's why I don't wear masks. I've worn them in the past for different jobs that I've done. They're not fun. They are hard to breathe through after a while. Um, now I've tried like the respirators in the N95 mask. I've tried full face masks as well. Now that one wasn't too bad. That was easier to breathe through than the N95 masks. But any kind of mask you do want to make sure they do form fit to your face. You want to make sure there's no excess air coming through. If there are any, if there are any other further updates, I will try and update you guys next weekend or this sometime during this week if I get the chance. But since things are really blooming up with the uh, COVID-19 cases here in the states and worldwide, I'll be trying to get you guys updated with that at least every week if possible. But until next time, I hope you guys stay safe, stay healthy, and don't go out and mingle with everybody.